Thank you, friends, for joining me. We've got an incredible team of Brampton New Democratic MP candidates. Really proud of them. Thanks for joining us today right here by Brampton Civic Hospital. You know, in 2015, Brampton sent 5 Liberal MPs to Ottawa. They voted for Prime Minister Justin Trudeau. And they did that because they were finished with years of Harper cuts. Times had become very difficult. Healthcare funding was getting squeezed and they wanted something different. Well, after 4 years of having these 5 Liberal MPs, people in Brampton continue to suffer. Healthcare is still not at the level it needs to be. Wait times are extremely long. Here at this hospital, in 2017, reports show that 4,352 people were treated in hallways. Hallway medicine has become a reality in this city, and it is simply wrong. Healthcare funding has been cut by Harper, and those cuts were continued by Mr. Trudeau. People have had enough with this. I'm here to say that is simply wrong. The neglect of Brampton is wrong. The neglect of healthcare is wrong. So what I'm here to do today is to commit to the following. We commit to building a new hospital in Brampton. We will support the funding for this new hospital. We also commit to supporting the expansion of Peel Memorial, and we commit to this, to ensuring that by 2020, we have pharmacare for all, so that everyone in our country has access to the medication they need. If you need medicine in our country, you should use your health card, not your credit card. That's gonna help this hospital. It's gonna free up time. Someone who can't afford their medication should not end up in a hospital bed because they couldn't treat their illness. We're gonna put an end to that. So thank you so much for joining us. We're gonna make better choices. We're gonna make sure that we take care of the people that need support. This is a crisis here in Brampton, but it's a reality for far too many people. We will invest more in healthcare to turn things around. Thank you so much, and I want folks to know I'm in it for them, I'm in it for you, and we're ready to take your questions. Yeah.
How can you commit to building a hospital? Isn't that a provincial jurisdiction? How would you actually do that?
It's absolutely a provincial jurisdiction, and what we're committing today is to make sure that we put the funding on the table to make this happen. We are committed to building this hospital, and we know we've got to work with the provincial government, but we can't just stand by and give up when we've got a conservative government that doesn't see the importance of building and investing in healthcare, and we've got a Liberal Prime Minister, Mr. Trudeau, who's neglected his responsibility. What we're doing today is saying we will partner, we will put the funding in place to support the building of a new hospital and expand Peel Memorial.
Just as a follow-up, yesterday, and you've spoken about this before, your plan to treat drugs as a health issue rather than a criminal issue. Can you tell us specifically what that means? Would you decriminalize drugs? Which drugs would you want to see decriminalized? Can you tell us exactly what you're talking about when you say that?
Sure. I spent a lot of time as a criminal defense lawyer, and I met a lot of people that were in the criminal justice system. And when I met with them and I spoke with them, really what they were struggling was, they were struggling with addiction, they were struggling with mental health, they were struggling with poverty. And the criminal justice system wasn't the way to deal with their problems. And we see that in Canada. We've got an opioid crisis. Thousands of Canadians are dying. And we've got to do things differently. We can't continue down the same path if we want to change the results. We've got to change our approach. And so what our approach is this: when people are struggling with addiction for personal use, when people are struggling with mental health and people are struggling with poverty, they shouldn't be treated with the criminal justice system. They should be treated with compassion and care with a healthcare response. And that's what I'm committed to doing. Making sure people who are in need, people who are addicted, people who are dealing with mental health, get mental health services, get addiction services. That is the way that we help people out and the way we save lives.
Bonjour, Monsieur Singh. Christian Noël de
Oui.
Radio-Canada. À propos de l'aide médicale à mourir, les tribunaux jugent que les critères sont trop serrés, notamment concernant la mort raisonnablement prévisible. Est-ce que vous souhaiteriez un assouplissement des règles et pourquoi?
Oui, ce qu'on a vu, c'est qu'il y a un manque sur les critères. Ils sont trop précises. En fait, ils sont trop spécifiques et ça n'inclut pas toutes les situations qui arrivent. Avec les résultats dans la Cour de justice au Québec, ça montre qu'il y a vraiment un problème avec la réglementation qui existe à ce moment. Donc oui, je suis tellement ouvert à à s'assurer que chacun qui a besoin de ce service peut avoir accès à cette décision. C'est tellement important pour la dignité. Et ce qu'on a vu à ce moment jusqu'à ça, le gouvernement libéraux, en fait, ils n'ont pas fait le travail qu'il faut faire. Et je suis prêt d'avoir une plus grande conversation, d'augmenter l'accès au service. So the question was around right now the access to folks who need medical assistance in dying. There's been concerns, a court decision that found that the criteria were too specific, too narrow. And I understand that that's a reality. People who need to make this choice for their dignity should be able to make the choice. And right now, the criteria being too narrow doesn't allow access to this decision for a lot of people. And so I'm open to looking at ways to making sure the access is improved and that we do it in a way that respects the dignity of someone to make that choice.
Et c'est votre premier débat comme chef ce soir. D'abord, est-ce qu'il y a un truc que quelqu'un proche de vous a donné pour vous aider? Et comment est-ce que vous allez mesurer votre succès ce soir au débat?
Donc, dans les débats, ce que je vais faire, c'est de toujours partager les histoires des gens, de monsieur, madame, tout le monde. Mon travail, c'est d'être une voix pour les gens, des voix pour les gens qui n'ont pas une voix. Et je vais utiliser ma plateforme toujours de montrer ce qui se passe avec la vie de la population et comment on peut aider les gens. Donc, le truc, c'est ça, de toujours mettre au cœur ce que j'ai toujours fait. C'est les gens, monsieur, madame, tout le monde, pour lesquels je me bats. C'est eux pour lesquels je suis ici et je vais continuer de faire ça.
Mr. Singh, Mike Lukuter from Global National. There's a vigorous debate now going around on e-cigarettes. Do you think that Canada should be doing something to ban vaping?
Well, I mean, all our decision when it comes to any sort of a product that's in the market should be based on evidence and should be based on the science. And if we have some science and evidence that point to a problem, then we should respond. And right now, that science is unclear. There are some concerns being raised, and I think we should be very careful to assess any sort of information that we have and make the best decision possible to protect citizens. And that includes vaping, e-cigarettes, and anything else that might arise in terms of information that we now have that should inform our decisions.
We already have some jurisdictions, and I know more recently the President of the United States is looking at it, flavored nicotine and that sort of thing. Would you, if you were Prime Minister, consider a nationwide ban on e-cigarettes?
What my concern would be is, as someone who doesn't smoke or drink, I really want to encourage people to make healthy decisions. I'm particularly worried about young people that might be influenced to get into a practice that they think is safe when it's really detrimental to their health. I want us to make good decisions and good policies that protect the safety and the health of Canadians. And so everything we do should be with that focus in mind. And if there's a way to move forward which discourages young people from making a bad decision, I want to do that. If there's information that we can provide to help people make a better decision towards their health, I want to do that.
Mr. Singh, Kevin Gallagher, CTV News. So we know that yesterday 2 NDP candidates had to step down for various reasons. There's been lots of reports about difficulty that your parties had to vet, recruit candidates. Sid Ryan called the process unprofessional. How can Canadians vote for you for Prime Minister if it seems you're having trouble organizing candidates for this upcoming election?
Well, I want to be clear. We're going to have all the candidates in place so that everyone in Canada can vote for a New Democrat no matter where they live. There's people that have to stand up, live up to our standards. As soon as information arises where they are not meeting the standards that we believe is important for our candidates to meet, we then move ahead to ensure that they're no longer candidates. And that's what happened recently, and we're going to continue to do that. If any information arises which makes us doubt the quality of a candidate, we're then going to move to say that those folks can no longer be candidates. I'm confident that people can trust us to know that we're making good decisions about the candidates we have. There is a high quality standard that we're trying to achieve, but more importantly, we're also trying our best to recruit the real representation of Canada. We haven't seen enough marginalized communities represented. We haven't seen enough women particularly represented in politics. So I'm working hard to make sure that our candidates reflect Canada. And that's a tough thing to do, but a very important thing to do.
But at what point do you have to strike a balance here to get a candidate in the riding before September 30th cutoff, right? So is there an issue with the vetting process in the party? What's holding you back here?
No, not at all. We've got a strong process. I've just put in place some sort of rigid demands. I really want to encourage equity-seeking folks to be reflected. I really believe it's important to change the way things have been done in the past. I want to do things differently, and that's hard to do, I know, but it's important for me, and so I'm really committed to making sure we have the most diverse list of candidates possible, people that really reflect who we are as Canadians, and particularly for me, a big emphasis is working hard on recruiting as many women as possible. That's important. It's hard. I know many people who are so qualified don't see themselves reflected in politics and then don't want to run. I really want to encourage them to run. It's important for me. That's why I'm working hard.
You just mentioned at the hi. You just mentioned at the top there that you
Hi, Anna.
put in the stricter, rigid demands. When though do you have to cut your losses so you get the 338?
Well, I'm an optimist. I believe we can always fight to make things better. I don't want to ever give up. So I'm committed to the vision of making sure we've got a candidate and that represent Canada, that represent who we are. So it's tough work, but it's important work. And I'm happy and proud that we're doing it. And we're going to continue to make sure that we've got the best list of candidates possible for people to choose from. But rest assured that by election day, everyone in Canada can vote for a New Democrat no matter where they live.
I want to ask you about tonight. This is your first official debate in a campaign as leader. So what are you personally thinking? What do you think are going to be your challenges in this?
I'm really excited, and I'm looking forward to it. One big challenge is Mr. Trudeau hasn't shown up for 4 years, and he's not showing up to this debate. I'm really disappointed by that. I think Canadians are disappointed. They expect that the Prime Minister should be able to stand up and respond to questions, hold up and defend his record. His record is pretty abysmal, but that doesn't mean he should give up on the debate. So that's going to be one of our challenges. How do we debate the Prime Minister who's responsible for many of the outcomes that we've seen over the past 4 years when he's not present? But we're still going to move ahead, of course, and we're going to make sure people know where we stand. And I'm going to take the opportunity to share the stories that I hear from people across this beautiful country.
Hi, Mr. Singh. Brian Platt with Post Media. You mentioned off the top the Liberals have every seat in Brampton right now.
That's right.
This is an area you've won provincially and you almost won federally in 2011. What do you have to do to win here in this election?
Well, we just have to look back and point out what Liberals have failed to do over the past 4 years. Right here, we're at Brampton Civic Hospital, and with 5 Liberal MPs, they have failed to improve the healthcare conditions here in Brampton. It's one of the biggest concerns. When you speak to people in Brampton, their concern is the hospital. The people who are standing in this line right now, this is really important for them, that we have a hospital that serves the needs of the community. This is one of the fastest growing communities in Canada. It is underserved, and the 5 Liberal MPs have failed the people of this city. We're going to show them that you don't have to accept bad or worse with Conservatives who are going to cut services even more, that they've got a real choice with New Democrats who are going to invest in building a new hospital. We're going to invest in expanding our healthcare, making sure that medication is covered for all. These are things that are really appeal to the people of Brampton, and I'm confident that they're going to see in us a real champion for them, someone who's going to fight for them, someone who's going to be on their side, because it's really clear we're in it for people, and they're going to see that.
Also sticking in Brampton, the issue of public safety is a big deal here as well. I'd like to know what plans you have for public safety improvements in Brampton as well, particularly with Peel Regional Police.
Certainly, public safety is a concern that impacts people across Canada. When we've spoken with people who are particularly concerned about public safety, we're worried about young people and young people who end up going down the wrong path. There's concerns around young people who don't see a bright future, don't see hope, and they end up mixing up in the wrong crowd, and then it creates a spiral. So from speaking to people who are experts in the field, people in the community, people that I've spoken to, they want to make sure young people have bright, promising futures, and that means making sure we've got the programs for them, making sure we make the right investments so that young people can see a bright future. They can get a job, they can own a home, that they don't have to resort to some of the negative decisions that sometimes the pressures around them encourage. We are confident that with our plan to build affordable housing, our plan to create 300,000 new quality jobs to tackle climate crisis, and our plan to improve healthcare will create the climate and the conditions to improve public safety, but also just the quality of life for everyone in our country, but particularly here in Brampton. Absolutely. We've got to invest federal money in youth education, youth services, youth programs. We want kids to have access to fitness programs. We want people to be healthy and active. And we want to encourage positive and bright futures that we know are possible if we make the right choices. And that's what we're committed to doing. Yes.
Hello, sir. Taran Ghuman from Hamdard Media. So
Sat Sri Akal ji.
federal government can provide funding for the hospital to the Brampton as you have made an announcement for the new Brampton hospital. But how you will make sure that the provincial government will not put their nose in this matter, as we all know, if you MPs will get elected, and how the benefits will be given to the Brampton.
It's a really good question. It's going to be difficult to work with a conservative premier who has not made healthcare a priority and instead has been cutting services. That is going to be a challenge. But what I'm committed to doing right now is just because it's a challenge doesn't mean we give up. New Democrats don't give up on people. We're in it for people. And that means that we're going to fight hard. We're going to say this is important. Here is the funding. We are ready to put money on the table to make sure we build this hospital. We have to work with the provincial government, that's true. But if we show the courage, we show the conviction, we show that we're ready, and we've got money available on the table to make this a reality, I can't see why a premier would say no to that, especially when the people need it so desperately.
Sat Sri Akal, this is Jasleen from PTC Punjabi.
Sat
My
Sri Akal.
question to you is in Punjabi. So,
Sure.
this ਤੁਹਾਡਾ ਨਵਾਂ ਕੈਂਪੇਨ ਹੈਗਾ ਫਰੈਸ਼ ਕੈਂਪੇਨ ਫਰਸਟ ਕੈਂਪੇਨ ਕਿਸ ਤਰ੍ਹਾਂ ਤੁਸੀਂ ਲੋਕਾਂ ਨੂੰ ਕਨਵਿੰਸ ਕਰੋਗੇ ਕਿ ਉਹ ਐਨਡੀਪੀ ਨੂੰ ਵੋਟ ਪਾਣ
ਜੀ ਬਹੁਤ ਮਿਹਰਬਾਨੀ ਪਹਿਲੀ ਤਾਂ ਇਹ ਗੱਲ ਆ ਕਿ ਆਪਾਂ ਪਿਛਲੇ 4 ਸਾਲ ਦੇਖਿਆ ਕਿ ਲਿਬਰਲ ਐਮਪੀ ਸਾਰੇ ਬ੍ਰੈਂਪਟਨ ਦੇ ਐਮਪੀ ਲਿਬਰਲ ਨੇ ਤੇ ਉਹਨਾਂ ਨੇ ਅਸਲ 'ਚ ਧੋਖਾ ਦਿੱਤਾ ਬ੍ਰੈਂਪਟਨ ਦੇ ਨਿਵਾਸੀਆਂ ਨੂੰ ਬ੍ਰੈਂਪਟਨ ਦੇ ਵਿੱਚ ਹੈਲਥ ਕੇਅਰ ਦਾ ਬਹੁਤ ਬੜੀ ਪਰੇਸ਼ਾਨੀ ਆ ਆਪਾਂ ਬ੍ਰੈਂਪਟਨ ਸਿਵਿਕ ਹਸਪੀਟਲ ਦੇ ਸਾਹਮਣੇ ਖੜੇ ਆ ਤੇ ਸਾਨੂੰ ਪਤਾ ਹੈ ਕਿ ਇੱਥੇ ਹਾਲਵੇ ਮੈਡੀਸਿਨ ਇੱਕ ਆਮ ਗੱਲ ਹੋ ਗਈ ਆਪਾਂ ਇਹ ਆਮ ਗੱਲ ਨੂੰ ਨਹੀਂ ਮੰਨਦੇ ਕਿ ਇਦਾਂ ਹੋਣਾ ਚਾਹੀਦਾ ਆਪਾਂ ਇਹਨੂੰ ਬਦਲਣਾ ਚਾਹੁੰਦੇ ਆ ਸੋ ਮੇਨ ਗੱਲ ਆ ਕਿ ਆਪਾਂ ਲੋਕਾਂ ਨੂੰ ਦਿਖਾਉਣਾ ਚਾਹੁੰਦੇ ਕਿ ਤੁਹਾਨੂੰ ਲਿਬਰਲ ਤੇ ਕੰਜ਼ਰਵੇਟਿਵ ਦੇ ਵਿੱਚ ਚੂਜ਼ ਕਰਨ ਦੀ ਲੋੜ ਨਹੀਂ ਤੁਸੀਂ ਐਨਡੀਪੀ ਨੂੰ ਚੁਣ ਸਕਦੇ ਹੋ ਜੋ ਕਿ ਤੁਹਾਡੇ ਵਾਸਤੇ ਇਸ ਸੂਬੇ ਦੇ ਵਿੱਚ ਇਸ ਸ਼ਹਿਰ ਦੇ ਵਿੱਚ ਆਪਾਂ ਵਾਅਦਾ ਕਰ ਰਹੇ ਹਾਂ ਕਿ ਆਪਾਂ ਇਸ ਹਸਪਤਾਲ ਦੀ ਪੂਰੀ ਫੰਡਿੰਗ ਪੇਸ਼ ਕਰਾਂਗੇ ਤਾਂ ਕਿ ਆਪਾਂ ਨਵਾਂ ਹਸਪਤਾਲ ਬਣਾਵਾਂਗੇ ਆਪਾਂ ਪੀਐਲ ਮੈਮੋਰੀਅਲ ਨੂੰ ਐਕਸਪੈਂਡ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹਾਂ ਨਾਲ ਦੇ ਨਾਲ ਜੋ ਆਪਣੇ ਦਵਾਈਆਂ ਦਾ ਖਰਚਾ ਆਪਾਂ ਚਾਹੁੰਦੇ ਹਾਂ ਕਿ ਜੇ ਕਿਸੇ ਨੂੰ ਦਵਾਈ ਦੀ ਲੋੜ ਹੋਵੇ ਉਹ ਆਪਣਾ ਹੈਲਥ ਕਾਰਡ ਵਰਤੇ ਨਾ ਕਿ ਕੋਈ ਕ੍ਰੈਡਿਟ ਕਾਰਡ ਆਪਾਂ ਇਹ ਸਿਹਤ ਸੇਵਾਵਾਂ ਦੇ ਵਿੱਚ ਹੋਰ ਫਾਈਨੈਂਸਿੰਗ ਕਰਾਂਗੇ ਇੱਕ ਨਵਾਂ ਪ੍ਰੋਗਰਾਮ ਬਣਾਵਾਂਗੇ ਜਿਹਦੇ 'ਚ ਪੂਰਾ ਕੈਨੇਡਾ ਪਰ ਆਪਾਂ ਆਪਣੇ ਬਾਇੰਗ ਪਾਵਰ ਵੱਧ ਕੇ ਮੈਡੀਕੇਸ਼ਨ ਦਾ ਜਿਹੜਾ ਖਰਚਾ ਪੂਰਾ ਘਟਾ ਕੇ ਆਪਾਂ ਉਹਨੂੰ ਇਨਕਲੂਡ ਕਰਾਂਗੇ ਸਾਡੇ ਸਿਹਤ ਸੇਵਾਵਾਂ ਦੇ ਵਿੱਚ ਇਹ ਗੱਲਾਂ ਦੇ ਨਾਲ ਲੋਕਾਂ ਨੂੰ ਪੂਰਾ ਉਮੀਦ ਹੋਣਾ ਚਾਹੀਦਾ ਕਿ ਆਪਾਂ ਉਹਦੇ ਨਾਲ ਆਪਾਂ ਲੋਕਾਂ ਦੇ ਨਾਲ ਨਾ ਕਿ ਵੱਡੇ ਜਿਹੜੇ ਅਮੀਰਾਂ ਵਾਸਤੇ ਕੰਮ ਕਰਨਾ ਆਪਾਂ ਆਮ ਲੋਕਾਂ ਵਾਸਤੇ ਕੰਮ ਕਰਨਾ ਥੈਂਕ ਯੂ ਜੀ Same question? Sure. Question was on how can I convince the people of Brampton to vote for New Democrats when they voted for Liberals in the past? And I said, well, let's just look at the past 4 years. The past 4 years have shown that Liberal MPs, all of which who represent Brampton, have failed the people of Brampton. They failed making sure that healthcare, which is one of the biggest concerns for Brampton, has not been addressed. They've failed to address that problem. And so what we're committing today is saying that, you don't need to choose between liberals or conservatives. Conservatives who are going to cut to make things worse and liberals who are going to take you for granted. We're saying that you can choose New Democrats who are going to fight for you. We're in it for you because we believe you deserve equal and adequate funding. That means building the additional hospital here in Brampton. A city that is as fast growing as Brampton deserves the right type of funding. And that means also expanding Peel Memorial. We also believe in making sure we've got medication coverage for all by 2020. That's something that's going to significantly improve the conditions in the hospital, but for people's lives in general. People can count on us. We'll be there for them.
So why are you promising to build a hospital in one community when hallway healthcare does appear to be a problem for all across Canada? I guess why are you spending this morning talking about one specific community when this issue is all across Canada?
The issue is truly across Canada, but if we look at hallway medicine, it's really here in Brampton Civic where it's at a real crisis level. I mentioned in 2017, a report showed it's literally 4,352 people were treated in hallways. That's a number that far exceeds anywhere else in Canada. It's one of the highest numbers for hallway medicine. It's a crisis level here. And what we're saying is we're committed to providing the funding to address this crisis. There's a crisis in Brampton and it's been neglected, and that's not going to stand with New Democrats. We believe that's wrong. We're also talking about a broader solution. With Pharmacare for All by 2020, that's going to alleviate a lot of pressures off of hospitals across Canada. Many people end up in the emergency room because they couldn't afford the medication that would have kept them well in the first place. That's creating a burden on the hospital system. That's a lot of waste because people who could have treated their illness end up in a $1,500 a day bed in an emergency room. It could have been avoided. That's why our plan is to tackle this crisis here in Brampton, but also the crisis broadly speaking across Canada.
What are your plans for the Canada Health Transfer? Do you plan to increase it or keep it at current levels?
Great question. I really want to point this out that Mr. Harper put in place a cut of $30 billion. That's what his plan was, to cut healthcare transfers by $30 billion. Now, he made the plan, but he didn't actually put it in place. It was Mr. Trudeau who put in place his $30 billion cut. And Mr. Scheer is talking about keeping it in place. We're saying that that is wrong. We need to actually increase investments in healthcare. The healthcare transfers used to be 50-50 between provinces and the federal government. Now they've dropped to 25% approximately at the federal level and 75% at the provincial level. That is wrong, and that's a lot of the reason why healthcare is in such a dismal condition right now. We want to change that. Thank you very much, everybody. Thank you so much. Thank you.